All right, so I'm Danny Heinrich, and Meg Moore is also here with us today. And we are two pathologists at the University of Minnesota Veterinary Medical Center. And today we wanted to talk about essentially just kind of standard diagnostics in veterinary medicine. So what happens when your veterinarian submits a sample to the lab? What does that mean? I feel like it's kind of a black box, and the sample just kind of comes back, and then the veterinarian tells you what the results are. So our goal today is to kind of cover some baseline diagnostics. We are certainly not going to cover every single diagnostic in veterinary medicine. So again, we're going to start kind of with what do veterinary pathologists do? Then we're going to talk about kind of the differences of veterinary pathologists. Then we're going to go through some examples of some common diagnostic tests. And then we're going to end with some case examples, kind of showing what we do in a clinical context. For instance, if it was your animal and a test was being submitted. So we wanted to start this picture up at the upper right corner, as if those of you that know, this is from Nosferatu, right? A classic vampire movie from, the early 1900s, I believe. And I kind of think, pathologists are kind of looked at as like, scary. We look for bits of blood and tissue, we take them away, we do things with them, we get hunchbacks because we work at a microscope all day, which all of that may be true, but we are also people and we are also veterinarians. And so again, the goal of that presentation. So what is pathology? It's the study of causes of disease in animals. And we do this for both the health of animals and humans. So it's called translational medicine when we are applying kind of animal health to help with human health. We study disease at the gross level, which is kind of looking at the animal in its entirety, but also looking at the microscopic level, at individual cells, and also looking at cell signaling kind of pathways within the body, even at a submicroscopic level. So where do pathologists work? We work in academia, so at universities. So if we're working at universities, we diagnose disease in the hospital, such as in the UMN Vet Medical Center. We complete research, and we also teach veterinary students and other students across the university. We also work in industry and private labs. So we may assist with new drug development for the pharmaceutical industry, doing toxicology research. We can help with device implant pathology, like fake heart valves, things of that nature. We also, in industry and private labs, will provide diagnostics for veterinarians outside of the university setting, so your general practice veterinarians. We also work in state and federal government, so we do disease tracking, research, and public health. And we also can work in the military. So besides being active military members, we can also provide care for service animals and provide diagnostics in that way as well. And then the question is, I'm going to let Meg kind of take this one over. Sorry.
Sure. Meg. Sorry. So, all right. So there are a couple of different types of veterinary pathologists. So Dr. Heinrich and myself are actually the two different types. So Dr. Heinrich is a clinical pathologist, and then I am an anatomic pathologist. And so, yes, first and foremost, veterinary pathologists are veterinarians. So we both went through the standard 4 years of veterinary school. And did all of the things that your regular veterinarian does to become a vet. And then beyond vet school, in order to specialize in veterinary pathology, you go on to do a residency that's either 3 to 4 years, and it depends on whether you're a clinical pathologist or an anatomic pathologist. If you go into clinical pathology, then you do an intern year where you're rotating on clinics, and then you apply for a 3-year residency program. With anatomic pathology, it's not required that you do an intern year, and so you can go right into the 3-year residency program. Most of those residency training programs are at the same institutes that have veterinary schools. So what is a clinical pathologist versus an anatomic pathologist? So I like to think of clinical pathologists as kind of dealing with anything that can be extracted with a needle for the most part. So all of the fluids and liquids and other things that you can acquire with a needle would fall under the purview of a clinical pathologist. So really the clinical pathologists are going to look at cells within those different fluids, so blood, urine, bone marrow, cerebral spinal fluid is another one, and look at that cell morphology and try to figure out what's going on. Clinical pathologists also are the ones who are validating various tests in labs, which is super important, right? When your dog or cat has blood work performed, for example, there are usually reference ranges, and all of those reference ranges have to be validated and to make sure that we are arriving at accurate interpretations with those blood tests. Anatomic pathologists specialize more in tissue. So anything that is keeping the tissue intact would fall under the purview of an anatomic pathologist such as myself. The other side of that is we also do necropsies, which are the animal version of an autopsy. The other part of that with anatomic pathology is looking at biopsies. And so we'll talk more about that in a little bit. And then there is a lot of overlap and we work closely together. I like to say that, for example, a biopsy is only one piece of the overall puzzle. And a lot of times it is super helpful to know what the clinical pathologist saw when they stuck a needle into the mass that I am then looking at a biopsy of.
Great. So then we're going to talk about who works in pathology labs, and then specifically who works in the University of Minnesota Pathology Lab, which does both clinical pathology and anatomic pathology, as Dr. Moore alluded to. So our clinical pathology lab is staffed by medical laboratory scientists, medical laboratory technicians, and principal laboratory technicians. So these are all individuals that have completed various degrees of training. It's anywhere from 2 to 4 years, sometimes after a bachelor's in some science field. They complete training in human laboratory medicine. And then when they come to us in the veterinary world, we cross-train them in veterinary medicine. And they also do some internships in specialty fields. So they are highly trained individuals that come to us. We also have histotechnicians. So those are people who are actually processing the samples that Dr. Moore is going to talk to you about later with regards to biopsies. We also employ DVM and undergrad students in our clinical pathology lab. So that's for part of their training. They can also be hourly workers and things of that nature. And then not specifically in our lab, but in labs across the country, certified veterinary technicians or veterinary nurses, though they will also work in labs. They generally will do the kind of standard general practice veterinary lab management, and we'll do kind of point of care testing. So it's kind of a group of various people that comes together as a team for completing diagnostic testing for your animals. And then there's 2 major types of diagnostic labs in vet med. And so those would be point of care or in-clinic labs. So what that means is that if you take your dog or cat or your horse, or maybe a vet comes out to see your large animal species like a cow, for instance, if you bring your animal to those veterinarians and they draw samples, they may run certain blood tests in their hospital setting. So that is called point of care testing. And then when you send samples out to a large lab, like an academic university lab or another specialty lab, that's called reference lab level testing. And the difference between these is kind of the degree of veracity that goes into the testing. So point of care labs are really good for giving immediate results, especially in urgent situations, and they are very good diagnostics. But if we want to send something out for kind of the top tier evaluation that we can give, that has the best kind of quality maintenance, then we send things out to academic or reference labs. Also, not all point of care in-hospital labs run every test. They can only run a limited array of tests because not everything's available for your general veterinarian to run. And so what they'll then do is send them out to specialty labs for those additional testing. And so what this photo is trying to show you is This is a reference level clinical chemistry analyzer. It's hard to do the scale of size of this, but this thing weighs 300 to 500 pounds. And this is a kind of point of care variation of that your regular veterinarian would have in their hospital. This probably weighs 30 to 50 pounds, so it's a small box. So when we send things out to reference labs, the machines are more complicated and much bigger. Both types of labs play a very important role in the management of your pets. Again, it just depends on what diagnostic is needed and what is being done. All right, so we're going to start with common clinical pathology tests, and then Dr. Moore is going to cover common anatomic pathology tests. So I'm going to start with things that can be collected with a blood draw. So the first one is called the complete blood count, or what is also termed a CBC. The complete blood count is used to look at the various types of cells that make up our blood. And we do that by both running the blood through a large analyzer, and also looking at them under a microscope. So this is kind of showing the process. Your veterinarian would draw blood into the same tubes that we use in human medicine. We would process the samples in small tubes. We would run them through our big fancy analyzers or a smaller fancy analyzer if this was in your regular veterinarian's office. We would also make a smear of that blood on a glass slide, and then a technologist would initially review the blood film, and then it would make its way to the pathologist for various reasons. What are the components of blood that we're looking at? We're looking at white blood cells, red blood cells, and platelets. White blood cells are those cells that are used to fight infection or cause inflammation in the body. They are called white blood cells because when we spin them down, you can't see it because this photo is too small, but they form a little layer that looks white. Red blood cells is what makes our blood look red. And these are probably the most commonly known part of blood that everyone thinks about. And these are cells that move oxygen around the body to various organs. And then platelets are small cells that are used to clot blood and to prevent bleeding. And so we also, besides looking at those cells, we look for cancer and we look for infectious diseases in the blood. So this is an example of what we see under the microscope when we look at the different cells in the blood. So the red kind of round cells are blood cells, and these are all from dogs. Well, this is actually from a bear, but we'll talk about that in a second. But these first two are from dogs. So these are our red blood cells that deliver oxygen throughout the body. These purple cells are our platelets. And then this is an example of a white blood cell right here. It's called a neutrophil. There are various types of white blood cells that we look at. Neutrophils are very big at fighting off infection in our body. Other things we can look for, this is an example of a dog who has something called distemper virus. So if you think about when you vaccinate your dog or your cat for various illnesses, distemper is a big one that we vaccinate dogs for. And this little kind of pink dot inside of this neutrophil and this little kind of purple pink dot on top of this red blood cell are examples of us actually seeing the distemper virus in the dog's blood. So the analyzer can't tell us that it's there, but we can find it when we look at the blood under the microscope. This is actually bear blood. So we get any species you can imagine. We say any species except humans, but we probably could look at human blood and do okay if we needed to. But this is actually bear blood. And this is what bears who have heartworm, muted me, sorry. This is what heartworm in bears looks like. So the same thing that dogs get. And so again, we can look for infectious disease. This is actually two heartworms. So one of them right here, and then it's kind of hugging the other heartworm next to it. This is an example, one of our residents, one of our clinical pathology residents, he created what he called Frankenstein blood. So he took blood from 5 different species of animals and he mixed them together and then made a slide. And he did this to kind of show the various kind of differences that all of the different species can look like. So it's kind of just to give everyone the kind of idea that what we do is complicated in the sense that every species looks kind of different. And you never know what species you're going to get on a daily basis. And we just kind of do the best that we can. And we utilize other specialists in the area. So if you look here, A is elephant. This is red blood cells from an elephant. This is a goat. This little oval shape is an alpaca. This is a dog. And then this is from a flamingo. So birds, reptiles, and amphibians have what's called a nucleus in their red blood cells. Mammals lose that nucleus. We don't actually know. No one has been able to definitively prove why birds maintain the nucleus of the red blood cell. There's lots of theories, but if you actually look into the papers that are written about it, no one seems to be able to agree. But this is just kind of to show you that size of the animal does not matter with regards to size of their red blood cells. So the elephant red blood cell is much smaller than the flamingo, but obviously an elephant is much bigger. So just to kind of show a fun example of the different species and what their blood can look like. This is similar where our resident Dr. Shiprack mixed to show the different white blood cells from a few species. So these are what are called eosinophils. So they have these pink granules in them, and eosinophils are generally used to fight off parasitic infections, but they are also involved in why we have allergies, unfortunately, and things like asthma. So A is an eosinophil from a dog. B is an eosinophil from a cat with these more kind of pink rice-shaped granules, and then the purple is its nucleus. And then C is, my opinion, the prettiest eosinophil, which is from a horse, which kind of we say looks a little bit like a raspberry. This is a photo. This is from a publication from a veterinary clinical pathology journal called Veterinary Clinical Pathology. And it's showing what, 1, 2, 3, 4, 5, at least 60 different what are called neutrophils from various species. And we're not going to go through all of these, and I don't expect you to read all of this. But just to kind of give you an example, B is from a Florida panther, so, a big cat. G is from a zebra right here. Q is an African elephant right here. And then R, for instance, is a manatee. And so it's just trying, again, to show everyone that all of these species, all of their white blood cells can look a little bit different. And so sometimes, we are able to be like, oh, I know that species, I've seen it before, and I know what I'm doing. And sometimes we get a species request from the zoo, and we're like, wow, we've never seen this before. And so what we do is very visual. And we look for examples from what's in the literature, what is in textbooks, or if there's nothing, we say, well, what's the closest species that we do know about, and we do some comparison. So again, it's just kind of to show the variation in what we look at on a daily basis, which is fun. This is actually a photo of a human blood film. So if we were to draw blood from any of you, this is what your platelets would look like. This is what your red blood cells would look like. And then these would be some white blood cells. So this would be a neutrophil right here. This is the outside of the cell, and then this is its nucleus, or kind of the brain of the cell. And then this is what's called a lymphocyte. So human blood, frankly, doesn't really look that different from dog or cat blood, to be honest, our kind of bread and butter species. And we do a lot of work in our lab with non-human primates, so monkeys and apes, and their blood looks very similar to human blood for obvious reasons, because we're very closely related to them. So again, to just kind of show that really things aren't that different between veterinary pathology and human pathology. All right, so moving on from the CBC, or the complete blood count, the next test that I'll talk about is a blood chemistry profile. And so what a blood chemistry profile does is, instead of looking at the blood as a whole, we spin that blood tube down, the red cells get removed, and then we're left with the liquid portion of the blood, which is either called plasma or serum. We take that fluid, we run it in an analyzer. So this is one of our medical technologists running it through one of our analyzers right here. And we then add a bunch of dyes and different enzymes and chemicals to the sample, and we look for reactions. And when reactions occur, there tends to be a change in color, and that change in color alters the ability for light to pass through the sample. That change in ability of light to pass through the sample is converted into a number, and then that number is what gives us our results. And why that is so important is, if your veterinarian asks you to please fast your dog or cat or whatever species before a blood draw, or if your doctor asks you to fast before a blood draw, this is why it's so important. So normally the liquid portion of our blood should be clear, which is about right here. I know it's kind of small. This is after an animal ate. So after we eat, we get a whole bunch of fat in our blood from the meal. And this is called lipemia. And so there's a whole bunch of little fat droplets floating around in this sample. And because of that, those fat droplets scatter light that are passing through it. And because of that, that means that the results that we get may not make sense because the light is scattering in directions that we do not expect it to. So if your veterinarian asks you to fast your patient, definitely fast your dog or cat. And if your human doctor asks you to fast yourself, definitely fast yourself because it's very important. What we look for with clinical chemistry profile is essentially function of our organs. So we look at things like liver function, kidney function, electrolytes, glucose. So if we're looking for things like diabetes, calcium, cholesterol, all of that stuff. We can look at lots of different organ functions from little tiny samples of blood. This is an example of what a blood report would look like if that would go out to your veterinarian, and then they would interpret it and give the data back to you, right, and tell you what's going on. So we generally at the university lump our blood tests into groups by what they do. So these first two tests, blood urea nitrogen and creatinine, these are all about kidney function. These tests, protein and albumin and globulin, are kind of looking at your blood protein levels. This group, alkaline phosphatase, alanine transferase, these are liver function tests. So we kind of look at all of that. And for the non-medical professional, a lot of this is just alphabet soup, right? And words that don't make sense. But veterinary students spend a lot of time kind of learning how to pronounce these words and then figure out what they mean. We then give our result. So what is the animal's result? And then we have what, like Dr. Moore alluded to, is what's called our reference range or our reference interval. So this is the range that we expect a healthy animal for their number to fall in. And then we get the number for the patient. So this patient's number is 11. It's normal because it's within 9 to 31. This patient's value is 0.5 right here, which is low because it should be 0.6 to 1.6. So that's how we interpret blood results for our patients. Okay, moving on. So we're kind of mostly sticking with things collected with a needle. And I'm just going to make sure I'm staying on time here, which I think we're doing okay. So things we can collect with a needle. We're going to talk about SNAP tests now. And SNAP tests are similar to methodology to now what everyone knows for the at-home COVID tests. So to not kind of give anyone any, pandemic-related trauma, but we're going to talk, about tests that are similar to those at-home COVID tests. And these are called SNAP tests. The fancy name for those are called lateral flow ELISAs. But the common kind of communication that we use is a SNAP test. And so what these SNAP tests are doing is they're looking for evidence of infection in the form of antibodies or antigens. We're not actually looking for direct infection under the microscope. So for instance, this is an example of a neutrophil from a dog. This is the outside of the cell, so it's a white blood cell. Here's its nucleus, or the brain of the cell. And then inside of the cytoplasm, or the liquid portion of the cell, we've got these little purple packets of dots. And these are little packets of bacteria. It's called Anaplasma phagocytophilum. It's a tick-borne illness. It is something that dogs and cats and horses and cows, lots of species get when a tick feeds. And it's also actually something that people can get as well when a tick feeds on them. But if we don't look at the blood in the right time, we're not going to find it because it only stays alive in the blood for a very short amount of time. So we use these SNAP tests to look for evidence of infection, either in the form of antibodies, which is the body's response to infection, or antigen, meaning we're looking for little bits and pieces of the bacteria or parasite when we're doing our testing. So things that you may have heard your veterinarian talk about are heartworm tests. So we use SNAP tests to look for antigens against heartworm. Lyme disease, so I think a lot of people know about Lyme disease, can be the exposure to Lyme or kind of previous infection with Lyme can be tested for with a SNAP test, and other tick-transmitted illnesses. Leptospirosis, which is a bacteria that is transmitted by small rodents in their urine. And so especially animals in the city, dogs who kind of are exposed to rodent urine, they can get this bacteria that causes kidney failure. So we can test for that. If you have a cat, feline leukemia virus or feline immunodeficiency virus, the cat version of HIV essentially. We test for that with these tests. And then we don't just look at blood, we also look at feces. So parvovirus, which is a viral infection that young puppies often get that can kill them, and Giardia, which is a common cause of diarrhea. It's actually a cause of travelers' diarrhea in people. So if you go, to out of the country and you get diarrhea, it's possible that you've gotten Giardia, and dogs can get that as well. And then if you're a horse owner, we can look for something called colostrum, which is the first milk, and antibodies and kind of that horses get when they drink that first milk when they're babies. So this is an example right here of different SNAP tests. So this is what we do is we apply the blood to these little dots. If it's a blood test, it floats across here, and then the color change indicates a positivity. So this is the control dot. So if you look, this is, my COVID test actually from when I had COVID. And so the same thing, you have your control line right here. And when you are positive, so here's positive, 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 this dog was actually infected with 3 different infectious agents. It was positive for heartworm, it was positive for Lyme, and it was positive for something called anaplasma. So unfortunately, it kind of hit the infectious disease jackpot. These are 2 different fecal tests. So we're testing for parvovirus or Giardia. Thankfully, we did not have to do poop testing of ourselves for COVID during the pandemic. That would have been pretty gross. But we do fecal SNAP tests. All right, other common laboratory tests that we talk about. So urine and feces. All right, so in urine, we look for things like infection, cancer, things like that, crystals in the urine. We do special tests where we dip to look for chemical changes, and we also look at them under the microscope. We can do urine cultures and antibiotic sensitivities. So that's where we grow the bacteria that are in urine on a plate to identify what kind of bacteria it is. And then we also apply antibiotics to see what is the best antibiotic to use in that patient. And then in feces, we look for parasites and other kind of infectious agents. So this is an example of some urinalysis findings. The arrows are pointing to red blood cells under the microscope. So there's blood in the urine. These are white blood cells, so there's inflammation. We look for things like crystals. And then this is kind of gross. This is a dog who had heartworm in its urine and a whole bunch of bacteria in the background. This is an example of urine culture. So we've grown urine on a plate, and all of these little dots are bacteria. So we would identify what kind of bacteria it is. And then this is where we've applied little antibiotic discs to figure out which antibiotic is most appropriate for your pet. All right, last one that I'll cover, and then we'll move on to Dr. Moore, will be cytology. So this, we say, if you poke it, we will come. And literally, like Dr. Moore said, anything you poke with a needle, we will look at. So this is where we poke a mass or a lymph node or an organ. We take that needle and we expel the cells onto a slide, and then we stain them, and then we look at them. Cytology is nice because it's minimally invasive. It's not very painful to poke something with a needle, thankfully. We can do very rapid turnaround, so we can get results back to you at the U during normal business hours, sometimes in under an hour. But if you work with your regular veterinarian, it can take up to 48 hours because they have to send it out. It's relatively inexpensive, comparing to anesthetizing your patient and doing biopsies. And we look for things like infection, inflammation, cancer, or other disease processes. Sometimes cytology is definitively diagnostic, meaning I can tell the veterinarian this is exactly what is going on in this patient. And sometimes it's not, and that's just a limitation of the test. And if it's not definitively diagnostic, then we have to go on and do other tests like a biopsy, which is what Dr. Moore is going to talk about. So this was just kind of showing what happens. So let's pretend this is a mass in your dog's skin. We've poked it with a needle. We've squirted the material onto a slide. We've stained it, and then we look at it. And this is an example where like a lymph node that was stained. And then this was an unfortunate scenario where the sample during staining washed off and it went onto the part of the slide that we can't actually look through, unfortunately. So nothing is foolproof, but this is what cytology looks like. These are some examples of cells or infections that we see under the microscope. So right here, all of these little purple circles that are kind of shiny, These are all a fungal infection called blastomycosis. It's a very common fungal infection in this part of the country. It is also something that humans can get, but don't worry, it's not like The Last of Us, for those of you that have been watching that TV show. It is not directly transmissible between animals or from animals to people, and it's not going to take over anyone's brain. It just causes very bad inflammation and organ damage. This on the right, these little crescents, we call them evil bananas because they're kind of banana shaped. That's toxoplasma. So you may have heard of that, especially any women in the audience that have had children. This is why you don't want to scoop your cat's litter box when you're pregnant, because pregnant women are very susceptible to getting this infection from cats, and it can damage the fetus. But sometimes we can see that under the microscope. This is an example of all of these are individual cells. So this is the nucleus or the brain of the cell, and then the cytoplasm or the liquid portion. This is an example of, I think there's only 3 transmissible cancers in the world, meaning a dog has cancer and it can directly give cancer to another dog. We see that also in Tasmanian devils and then clams. Clams have a transmissible blood cancer. So this is called transmissible venereal tumor, and it is a spreadable cancer between dogs that we can diagnose with cytology. And then the last one, this is a fluid sample from a cat. This is from its abdominal fluid. So normally there isn't fluid in the abdomen in between our body and our intestines. And if there is fluid, that's not good, and we want to look at it. So this is an example where the patient had a perforated intestine, and its intestinal contents were leaking out into the fluid. And so what we're seeing here are all of these little lines. These blue lines are bacteria, which you don't want in your abdomen. And then these are little yeast circles as well. So this is what we term a septic abdomen. So just some kind of pretty examples of what cytology can look like. And with that, I'm going to give it over to Dr. Moore.
All right, thanks, Dr. Heinrich. Okay, so moving on to some of the tests that are common under the anatomic pathology framework, which again is more tissue-based, so keeping the tissue intact. And so one of the common things that anatomic pathologists will do that your dog or cat might, or goat or horse or reptile, whatever animal you may have, might undergo at some point would be a surgical biopsy. And so essentially what a biopsy is it's a procedure that involves the surgical removal of tissue from either a lump or a mass for examination under a microscope. And sometimes it's not even a lump or a mass. Sometimes, for example, you might have a bunch of red spots on the skin that you want to look at. So we can look at those too. But the idea is that it is more involved than poking something with a needle. And so as Dr. Heinrich alluded to, you know, the positive of this is that it allows us to look at what the cells are doing within that tissue, and the tissue is intact in a way that, for example, if we're concerned about a cancer, we can see if the cells are invading and how far they are invading into that tissue. So it has the added benefit of looking at the overall disease or lesion in context, which can be helpful in instances where just looking at the cells through a cytological prep that Dr. Heinrich just showed you is not fully conclusive. And so we can be more definitive in our diagnosis sometimes with a biopsy. Some of the negatives are it is more invasive. So often your pet needs to be sedated or even anesthetized in order to get these samples. And so with that, it is also more expensive. And then the other thing that takes longer, and I'll get into that a little bit, is the turnaround time is not as quick. So we cannot give you an answer within an hour because the tissue has to be fixed in formalin, and that takes time. And so to give you a sense, it takes 10 hours for a tissue that is about 1 centimeter thick to be fully fixed. And so if you start thinking about some of our samples that are much larger than that, they need to sit for 24 hours or more before we can even start to process them and get them onto a slide to look at. So not as fast of an answer either. Some of the common types of biopsies that we look at are punch biopsies. So the image on the lower left there is showing a cutaneous or a skin punch biopsy that some of you may have also experienced if you have visited a dermatologist. This is how they will sample any kind of freckles or moles or things that they might want to look at. Wedge biopsies are exactly what they sound like. So you kind of are cutting out a wedge of that tissue. Incisional biopsies are specifically taking smaller portions of a mass, whereas an excisional biopsy is when you're trying to take out the entire mass. And I'll talk a little bit about that in a minute as well. Endoscopic biopsies. So this middle image here is actually showing endoscopic biopsy samples that have been placed in what we call a tissue cassette. And so you can get a sense of how small some of these biopsies are, but essentially our clinicians will go in with an endoscope into the intestine. They can visualize what they are looking for, and then they can use biopsy forceps to take little pinches of that intestinal or stomach lining to look at. And so we'll look at those. Rhinoscopic is same thing in the nose. So if you're looking, if your dog or cat has had chronic nasal discharge, and we're trying to figure out what's going on, we'll commonly take biopsies of the inside of the nose. And then cystoscopic would be of the urinary bladder and looking at that. So those are just some examples. The image all the way on the right there is showing an ultrasound guided biopsy. So we're using ultrasound to acquire a sample of a liver mass. And so we can use special devices to take, essentially this would be called a true cut biopsy. So it's a little bit larger than a needle and allows you to take a core of that liver mass to look at. All right, with that, Dr. Heinrich, we can advance. Awesome. Other examples of surgical biopsies are whole organ or large specimen biopsies. Oh, and I apologize. I meant to warn you all before we flip to this slide. I do have a few pictures in here that if you are squeamish, you may want to look away. My warning is late, so I've already failed in my mission. So I apologize for that. But hopefully you are all okay with some gross images. There's only one other slide that has some. So the upper left-hand slide here is showing a normal spleen from a dog. And then the next one over to the right is showing an abnormal spleen. So that is a spleen that has been, is affected by multiple different masses. And so in dogs in particular, one of the unfortunate cancers that is rather common is called hemangiosarcoma, which is unfortunately a pretty aggressive cancer, but there are other less aggressive or non-aggressive things that also affect the spleen. And there's really no way to tell the difference between those without a biopsy. And so what is commonly done in vet med is that the entire spleen is removed because, fun fact, you don't need it to survive, thankfully. And so we will remove the entire spleen in order to be able to make sure that we're not missing any kind of aggressive cancer and to confirm that it is either a benign or a more malignant process. And so that's a really common example of a whole organ that we would look at. Other examples include eye enucleations. And so the last image there is of an eye, and hopefully you can kind of appreciate that. And this, I think, drives home the point that as an anatomic pathologist, we look at the entire tissue and with its preserved architecture. And so with eyes, you can see the lens and the cornea and the sclera, all of the different parts of that organ can be assessed for disease. And then I'll just skip back, sorry, a little disjointed, but the image right there that Dr. Heinrich is pointing to is actually the cells, or what we see under the microscope, from one of the masses on that spleen. And so in this case, unfortunately, it was hemangiosarcoma, which is an aggressive cancer that we commonly see affecting the spleen in dogs. All right, so just to give you a sense of the process involved, so if your veterinarian recommends that a biopsy is taken, say your dog or cat has a skin mass, then they will take that biopsy and they will place it in formalin, which is our fixative. So that's what preserves that tissue and kind of freezes that tissue and stops it from, disintegrating or degrading. After it is fixed, and again, that can take some time, up to 24, 48 hours, depending on how large that tissue is. We send it through a tissue processor, which is a large piece of equipment that automatically processes that tissue further. From there, it gets embedded in wax, so in paraffin wax. And so the tissue sits and in the lower left image there, you can see there's two pieces of tissue in a wax block. From there, it gets placed on a machine or an instrument called a microtome. And it is that wax with the tissue is cut into these thin, very thin, so usually about 5 micrometer thick sections. And then using a water bath, the wax is floated on a water bath, and the slide is basically, the section is basically floated onto the glass slide and then stained. And after all of that, it finally comes to my microscope for evaluation. And so that's when the pathologist receives the slide and can actually assess it and provide a report with a diagnosis. Okay, and so these are just some examples to give you a sense of the wide variety and I personally, although I am biased, the beauty of what we see with biopsies. And that's purely from an aesthetic standpoint. I don't mean that to say that cancer is a beautiful thing. It is obviously not. And I always celebrate when I can provide a diagnosis that is more benign or positive. But it does allow us to get a really good idea of what is going on with your pet, and to hopefully be able to provide an accurate and very thorough assessment of what's going on so that then we can target the treatment that is appropriate for whatever is happening. So these are just some examples. The upper left is showing some skin, so that's haired skin up there, and there is an actual follicular tumor right there that is originating from a hair follicle and is a benign tumor that we will commonly see in dogs and cats. The upper right hand side is an example of a lipoma. You've probably, you may have heard of lipomas. They are benign fatty tumors. It's basically a tumor of fat. And so all of those round clear cells are actually fat cells. These are, again, quite common, particularly as your dog or cat begins to age. You might feel some soft masses, and those are often lipomas. This one down lower left is actually a more malignant tumor that was in I believe it was in the oral cavity or the mouth of a cat, and it is a squamous cell carcinoma. And then over bottom right, we have an example of a soft tissue sarcoma, which is another common cancer that we diagnose, particularly in dogs. And then here are just some other examples to give you a sense of what we see on the slide. So upper left are endoscopic biopsies. So again, those tiny little pinch biopsies that we get, or the clinicians will get of the stomach or the intestinal lining that we can then look at. Commonly in cats, if we're concerned about inflammatory bowel disease, this is how we would help to try to rule that out or rule that in. Upper right is skeletal muscle. So those are from muscle of a dog, very pretty again. And some of those muscle cells are actually regenerating. And so we can look and determine what's going on there. Lower left is an inflammatory process. So there's a bunch of neutrophils, which Dr. Heinrich showed you what those look like in the blood. And so this was inflammation of the skin. And then the lower right is an example of a bladder tumor. And so this is to give you a sense of, we can kind of tell how far the tumor is invading into the bladder wall. So right along that line that Dr. Heinrich is drawing there is essentially where that cancer is starting to stop. And that can affect things such as tumor grade, which I will briefly talk about as well. Okay, so one of the other important things that hopefully you haven't had to experience with your dog or cat, but if they are diagnosed with a tumor and your veterinarian goes to remove that tumor, that is referred to as an excisional biopsy, and we want to confirm that all of the tumor was removed or all of the cancer was removed. And the way that we are able to do that is either the surgeons, when they are performing the surgery and they have removed the mass, or our lab technicians, when they receive it, will use something referred to as surgical ink to mark the outer margins of that tumor. And then we can look under the microscope to see if there are cancer cells that are hitting up against those margins. And so the image on the right there is showing a mammary tumor where unfortunately the cancer cells are right up against that black inked margin. And so that means that there is a chance that some of the cancer was left behind. And so that would be something that I would portray to your veterinarian or the surgeon, and then they would want to make recommendations based on that, probably to monitor that site more closely, potentially to go back and try to remove more of that surrounding tissue. So again, it essentially allows us to dictate what we do from there. All right, I'm going to try to speed up a little bit because I know we're going over and we want to leave time for questions. So very briefly, you may, if again, unfortunately, your dog or cat or animal has been diagnosed with cancer previously. Some cancers have, some particular types of cancer do have grading systems, so it might come with a grade. A common example of this in veterinary medicine are mast cell tumors, which tend to affect the skin, particularly in dogs. And those will come with a grade. And there's actually multiple different types of grading schemes that we can apply, and they're based on different things about those cells that we look at. So things like how big the nucleus or the brain of those cells are, or how different they are in size. How often we see cells that are dividing, which are referred to as mitotic figures. All of those are applied and assessed by an anatomic pathologist to provide a grade on that tumor. And then that can be used to help try to predict how that tumor is going to behave and what the prognosis might be for your pet. That is different than a tumor stage. So you may have heard of this as well, and that's more of the clinical assessment of the tumor. So how big is it, and has it spread to lymph nodes or other areas of the body? And that would be a stage, and that's done usually by an oncologist who is working with you and your pet. Okay, and then very briefly, there are other things that we can do as well, calling for backup. So sometimes just the standard staining is not enough, but we can go looking for either bacteria or fungal organisms or parasites with other special stains that will help to highlight them. And similarly, there's something called immunohistochemistry, which is essentially a fancy term for using different markers that cells produce to try to identify what those cells are. So an example would be if your dog or cat is diagnosed with lymphoma, we can further subtype that into a B cell lymphoma or a T cell lymphoma based on the immunohistochemistry markers. Oh, and I forgot to warn you again. So this is the other slide. Oh man, I totally failed. I apologize. The other slide with some gross images. So the other thing that anatomic pathologists do are necropsies. So in the unfortunate event that your animal has died or you chose to euthanize and you want to find out more information, anatomic pathologists also perform necropsies, which are essentially autopsies of your animal to try to find answers. And then digital pathology is the wave of the future. It is actually here. Not to degrade my own profession, but there is a paper that talks about how they trained pigeons to do my job. And they were able to train pigeons to actually recognize the difference between a malignant mammary or breast cancer and a benign breast cancer or breast mass. And so there's lots of exciting things happening. In the wake of the pandemic, it has been really helpful to have digital pathology. So essentially you can take a slide and you can scan it, and I can look at it on my computer screen and do the same exact things that I would do with a microscope.
And I think for sake of time, we were going to give just a case example, but we didn't know if we were going to have time. So we'd rather hear questions so we don't go too far over. So I think with that, we are glad to take any audience questions.
Perfect. Thank you so much, Dr. Heinrich and Dr. Moore, for a wonderful and very thorough presentation. We had lots of great questions submitted in advance, and a few have come through during the presentation. So if you're ready, I'll start kind of throwing them out there. I'll let you two decide who wants to answer it, or both.
Sure. We're ready.
All right. The first one is, I think, Dr. Heinrich, you talked a little bit about kind of senior blood work or for elderly cats and dogs. What kind of makes up what would encompass senior blood work?
Yeah, so senior blood work, really there's kind of different panels that your veterinarian can order, kind of deciding what tests they want to do. But if you're doing what's called a minimum database, looking at like everything kind of generally, we would do that complete blood count. So looking at the red cells, white cells, platelets. We would do a blood chemistry looking at organ function. And then if your animal has not urinated before coming into the vet, and if they're not, if they're amendable to us collecting urine, we would also look at a urine sample. So those three tests probably are kind of the most commonly run for that.
Perfect. Thank you. And then kind of at the opposite end of that question, at what age should people start with an annual, for their pet, should they start with an annual CBC test?
Yeah, so it's funny, that's a philosophical viewpoint depending on who you talk to. So in the ideal scenario, we would probably do a full panel when your patient is young and healthy. So that way we know what their blood looks like when they're quote unquote normal. And then once they're getting older, so I don't know, for a cat, I would start saying, 7, 8. For a dog, it depends on the size of the dog, right? So a massive giant breed dog, 4 or 5 is old, but a small breed dog, similar to a cat. So yeah, it's kind of a good question to kind of talk about with your veterinarian specifically. But if you have healthy young blood work, we then have a nice comparison to see what's changed when your patient is sick or potentially older.
Got it. Thank you. A couple of questions about biopsies came through. One was, is there any risk of puncturing a biopsy that would cause any sort of like spread or seeding of the tumor to other areas of the body?
Yeah, so that's a really good question. Also a bit controversial, I would say. In the human medicine literature, it has been found that yes, so when you take a biopsy of something, of a mass, say, and it turns out to be cancer, there is concern that as you pull out the punch biopsy or the needle or whatever you are using, that you can dislodge some of those cancer cells and that they can then establish another site of cancer. And so that's kind of the concern there. It's been found to be incredibly rare. And usually, or I would say in almost all cases, the benefits of having an accurate diagnosis and getting that biopsy are going to far outweigh the risk of the potential of that happening. There are certain kinds of cancer that are known to be more prone to that. So for example, in the bladder, a bladder cancer, if a biopsy is acquired with ultrasound guidance, it has been shown that those have a higher propensity to be seeded and to kind of spread that way. But again, it's still really rare. And getting that biopsy to arrive at an accurate diagnosis and to dictate treatment from there is probably going to be more beneficial to your pet than that risk. Great,
thank you. Yeah. Somebody asked, should they biopsy every lump and bump they find on their dog or cat?
Yeah, so I'm biased. Send me all of the biopsies, please. I think it is a conversation you should certainly have with your veterinarian. I would recommend, if you notice lumps and bumps, I think it's always good to it's fun to pet your animal anyways, right? So if you start to feel things, it's good to monitor them. If they start to change in size or they start to feel different, then it's probably a really good idea to get that lump or bump checked. But I also think it is really wise to chat with your veterinarian who knows your animal and is familiar with them to figure out what the best move is.
And I would put a plug in. That's the nice thing about cytology is, we can very easily look at lumps and bumps with a needle and kind of not in every case, but in a lot of cases, we can give you an idea about what's going on and whether we should aggressively move forward with biopsy. So that's kind of where they're complementary diagnostics. So.
Thank you. Somebody just asked a question, which I think kind of combines both. You might have covered it a little bit, but just to double down. So should you fast a dog coming in yearly for physicals along with checking the lumps and the bumps on the skin?
So with regards to the blood, ideally, yes, if your patient can medically tolerate being fasted, right? So you need to have a conversation with your veterinarian. Like if your patient is diabetic, we need to be more careful. If your patient is very tiny and young, we don't want to fast them. So that's something you should definitely ask your veterinarian first, but the safest thing is to fast. And so, sometimes that all we need is 8 hours, overnight kind of thing. Same thing with lumps and bumps. You should always let your veterinarian know if you find any new lumps and bumps, because we don't spend as much time, as you do with your pet. And so you're often likely to feel like a mass, that's small that we may miss. So it's always really important to bring that up if you feel anything, and then your veterinarian and you can have a conversation about how do you want to move forward. Do you just want to aspirate it, or are they going to move immediately with a biopsy because just the way it looks is so scary, they just want to get it off? So
thank you. Somebody else asked, and I'm fascinated to hear your response to it, but does your group have any experience with diabetes monitors like Freestyle Libre with cats and dogs? And if so, what are your thoughts on that application or the future application of it?
Yeah, so our internal medicine group is using it. These are kind of portable, or like these monitors that we can attach to the skin and monitor diabetic patients. I think what we've noted, they do work. They work okay. They're not, the like God's gift to diabetes monitoring or anything like that in veterinary medicine, but they work decently. I think the biggest issue is we have some technical issues with them. Like we don't always get the readings that we want, or they'll fall off. Also, those devices are sampling a different part of the tissue. They're sampling glucose from a different part of the body than the vein. So results are not always comparable, but in certain instances, our internal medicine service definitely uses them. So.
Thank you. I think we got time for one more question, and it's a seasonal one. So somebody asked a little bit about ticks. So if somebody found a tick on their cat or dog that was kind of slightly engorged or full, at what point should they do a Lyme's test, and what do they need to look for?
Yeah, so it's also an interesting question. It's a little bit veterinarian dependent. So we're not going to see the Lyme disease. We cannot see Lyme disease under a microscope. We can't visually see it. So we're not able to diagnose dogs when they are actively infected. We're only able to diagnose them once they've mounted an immune response to the infection. So when they've formed what are called antibodies. So it generally takes anywhere from 3 to 6 weeks after infection with the organism to start seeing antibodies. So I would say, if you talk with your veterinarian and you guys are going to be very aggressive with monitoring, you would probably repeat a snap test 3 to 4 weeks later. The reality is most people don't do that as long as their animal is acting normal and acting healthy. And then they may just do the once a year monitoring, because if the problem with, I could spend an hour talking about this, so I'm not going to do because it's very complicated, but just because your patient has a positive snap test does not mean that it's infected anymore. The body may have cleared it. So, we're just dealing with the immune response left over. Just because you have a positive doesn't mean we always have to treat your patient. So certainly if your dog is acting sick, get it in right away. Otherwise, call your vet and you guys will have that conversation and say, how aggressive do we want to be? Or as long as my dog's acting normal, let's just, check in 6 months when we would do our normal screening. things of that nature.